Hi there. My name is Mary Miller, and I am a lactation consultant with the Breastfeeding Support Center of Western New York. This is our parent guide to optimal TOTs management, or tethered oral tissues management, in your baby. If you're watching this video, you've already made it further than the majority of parents, and in doing so have taken an enormous step forward in addressing your child's struggles with oral and facial function. There are a lot of misconceptions online about the best way to treat tethered oral tissues. The following is what we have found to work best through years of academic research, professional education initiatives, and years of shared interdisciplinary experiences. The first time you come in and see us at the Breastfeeding Support Center of Western New York, we'll sit down together to discuss your family's history, and we'll assess your baby's reflexes and their body's range of motion. A baby relies on what we call primitive reflexes in order to effectively nurse and progress through their normal developmental stages. Sometimes things can happen during pregnancy, birth, or your baby's brief time earthside that may disrupt these reflexes, which can result in difficult breastfeeding. We'll check these out, and if your baby has any reflexes that haven't developed normally, we'll give you some exercises to do with your baby that can reset and jumpstart them so that you can rest assured that your baby will be able to progress through the stages of developmental growth as nature intended. Underneath our skin, laid over our muscles, is a connective tissue called fascia. This tissue, when it's working properly, among other things, allows for a full range of motion for our muscles. Sometimes this tissue gets some kinks in it, which results in tension that prevents a full range of motion for the muscles it's connected to. This can be caused by fetal or birth trauma. It can be caused by lip, tongue, or cheek ties, or a combination of all these factors. In order to address this tension and ensure your child has a full range of motion available to them, we need to assess the whole body and determine where the points of tension are so that we can figure out what needs fixing. When you feed your baby, we're observing for a variety of potential challenges that your baby may have to provide more insight for us for how to design your individualized treatment plan. We're listening and watching for dysfunctional suck, swallow, and breathe patterns, and observing your baby's behavior at different points throughout their feeding to better hone our treatments in a sensitive and supportive way. We offer a hands-off approach, unless you specifically request hands-on, to allow the opportunity for the parent to feel what needs to be done in order to optimize the latch and or the nursing position. We believe that parents in their postpartum learn better by doing rather than having things done for them. At the Breastfeeding Support Center of Western New York, you'll have the benefit of having a treatment plan tailored for your individual circumstances and feeding goals. While we do see many similar sets of struggles, the unique interaction of your baby's ability to draw milk from the breast or bottle and the shape of that breast or bottle and in combination with the flow of the milk from it work together to create a unique circumstance for each family we see. Not only will your plan be created for you, but you will also have access to ongoing support through text or phone calls with your IBCLC in between appointments so that we can help minimize the frequency of office visits and to ensure that you are feeling confident in how to follow your plan in order to meet your feeding goals. The first phase of treatment involves addressing tension in that fascia. If your baby does not have a tongue, lip, or cheek tie, then this phase will be the primary phase of your child's treatment, and we will have appointments every few weeks to ensure that adequate progress is being made with regard to your baby's range of motion throughout all the various muscle groups in their body, and we will also track their functional development and make sure that it stays on track. If your baby does have a tongue, lip, or cheek tie, the fascia will be especially tight around each tie. When this tension is still present, the revision provider or the frenectomy provider may have difficulty releasing the entire tether because it may not be fully visible because of this tension. Smoothing this tissue out with the exercises that we recommend for your child, in combination with body work done by a craniosacral therapist, is the best way to ensure that their revision is a success. And it will also help prepare the tissue for the procedure to reduce your child's risk of developing restrictive scar tissue afterwards. You may be tempted to skip this step and go straight to the revision, but we cannot stress enough that this is not in your child's best interest. During this phase, as your child begins to have some better muscular mobility due to that gradual release of fascia tension, and your baby will have the ability to move their tongue, lips, or cheeks with a wider range of motion than they had previously. This means they can now begin to develop the strength and coordination that they really need in these muscles. Also during this phase, we will be beginning a rigorous exercise regime to help them develop functional ability in all these areas. This work will help to support optimal orofacial function. If your baby is tied and has a revision, these muscles will be able to move in ways they've never moved before. Since they've never moved the way they're supposed to, they will never have had the opportunity to develop strength and optimal function. Our exercises will ensure that when the release does happen, the auxiliary muscles will be in a better place to support the newly released ones with greater functionality, helping to ensure that your baby has a symptom reduction as quickly as possible. This phase of treatment can last anywhere from 1 to 3 weeks. If your baby has a tongue, lip, or cheek tie, then the revision itself, also called a frenectomy, is the second phase of treatment. During this frenectomy, a dentist will use a laser to thoroughly remove all the tissue that's preventing the full range of motion in your child's tongue, lips, or cheeks. You will have been provided with information about the most effective revision providers in the state and provided with a protocol that will address issues of pain, inflammation, and will help guide proper healing during your initial appointment with us if we feel that your child would benefit from this procedure. You will find that there are plenty of providers who offer this procedure, but we are only going to refer you to those whose work we believe in, as they've demonstrated time and again that their practices are indeed evidence-based, that they have a thorough understanding of optimal oral function, and how their work can support your child's ability to live free of symptoms related to their ties. Further, it is important to us to ensure that your care is as complete as possible by referring you to providers who are comfortable working as part of an interdisciplinary team, where you can feel confident that we are all in touch with one another and working together to help your child move on to a healthier and happier season of their lives. The third phase is orohabilitation. This phase may last from 4 to 8 weeks after the revision if your child needed surgical intervention for their tethers. During this time, you'll continue doing various exercises prescribed by your lactation consultant in order to support optimal healing, growth, and development of function, and also to better manage any feeding challenges that your child's been having. It is important to finish your habilitative treatment completely, or your child will be at risk of suboptimal healing and subsequently a recurrence of symptoms or the development of new symptoms over time. You've put in so much work already. Make sure to please stay the course so that your child can reap the benefits. To schedule your child's oral assessment, please reach out to us through our website, www.breastfeedingsupportcenterwny.com. You'll find a scheduling page in the menu where you can simply follow the prompts to get your patient portal created, your health history completed, and we'll get you into our scheduling system so that you can choose a day and time for your appointment that works best for you and your family. Thank you so much for watching. We look forward to working with you and your child.